Now I want to look at an imaging feature which is usually seen when there is what? Osteolysis, and it is described as what? Areas of bone destruction with radiolucent blades of grass of flame-shaped appearance in long bones. Okay. So osteolysis. Anytime you hear lysis, of course, they are talking about like something is being what? Chopped off. Okay, eaten away. So we said that it's a classic radiographic feature of what? Paget's disease of the bone, also known as what? Osteitis deformans. So Paget's disease is a chronic disorder of the bone remodeling. It's characterized by excessive osteoblastic bone resorption, which is usually followed by disorganized osteoblastic bone formation. So it results into weak, enlarged, and deformed bones. Okay. So radiographic phase: blade of grass of flame-shaped radiolucency in long bones, especially the tibia and the femur. Represent advanced front of bone resorption. So mixed phase, you see patchy sclerosis and lytic areas, usually called cotton wool, but that one is usually seen in the skull. I did bring the picture of the skull here. So it results in what? Structural weakness, enlargement, and the bones there are deformed. Okay, this is just the pathophysiology rather, So sclerotic phase is when you're having thickened, deformed bones with cortical expansion. So clinical features is what? There's a lot of bone pains, there's deformities, the bone is weak, could get fractured. When the skull is involved, it's enlarged, there's hearing loss because of the cranial nerve 8, it's compressed, and there's increased vascularity. So diagnosis is the x-ray that you use now. Then the laboratory test where you basically do test for alkaline phosphatase. You see that it is elevated. So management is all those biphosphonates and like all those zoledronic acid and alendronic acid, then also calcitonin,